Dr. Bharti, can you hear us?
Like,
So we welcome everyone, and today I have with me Dr. Vijaya Bharthi, and she's from Telangana, and we're going to talk to you all about egg freezing. Am I audible to you, Dr. Vijaya? So till the time she connects with us, so I'd like to welcome all of you, and it's a great honor for me to welcome you all today here. And this is a part of our bi-weekly program where we talk about multiple issues which pertain to all of us. And today's topic for us is talk about egg freezing. Till the time Madam just gets online, I think she's having some difficulty in her Wi-Fi connection at Telangana. Dr. Vijay, can you hear us?
hear you now.
Yeah, over to you. Over to you, Dr.
Hello.
Vijay. Over to you. Yes, over to you.
Hello. Good afternoon.
Hi.
My gynecological friends, ART specialists, and my friends who have logged into this live session today. I am Dr. Vijaya Bharthi, a fertility consultant to Vijaya Fertility Center, Godavarkani, Telangana State. I have been practicing my IVF since 7 years and as a gynecologist and obstetrician for the past 23 years. I feel proud and honored to share the platform with the renowned ART specialist, Dr. Pankaj Talwar sir. He is a great academician, not only a great academician, he is a great human being also. I happened to go to his ICAT Academy to learn clinical embryology. Sir has taught us so many practical aspects regarding clinical.
So I think we lost our signal again. So guys, welcome, and we have a lot of you who have joined in today. Today's topic, which we want to speak today, is about egg freezing, and the common thing is that Dr. Bharti, you're back. You're back. Your signal dropped.
Yes, sir.
Yeah, back to you. Back. Don't worry, it happens.
Yeah. So, I came to your ICAT Academy. It transferred me like anything. I could learn so many practical aspects regarding clinical embryo. I was so dumb before that. When I came to your academy, it helped me a lot. And also, it has improved my live pregnancy rates also. Thank you
Wow, wow,
so
wow. Thank you, thank
much,
you,
sir.
thank you.
And I feel proud to be an alumnus of ICAT Academy because you give a continuous learning. You give continuous learn and you'll give and spread the so much of knowledge to the students. And I thank ICAT Academy for giving me this opportunity.
So first question which we wanted to speak to you all about was that what is egg freezing? So eggs we call in our we call them as oocytes, we call them as dim, and they are the ones which come from the ovary. So nowadays a large number of women are coming to us for egg freezing, and we like to look at it. What is egg freezing? So normally when you look at our lives, the woman produces one egg, mature egg every month, which in case it is get fertilized, we get a pregnancy. But nowadays, due to multiple reasons, we have a technology where we are able to freeze the eggs, and that is called egg freezing. So egg is an egg, and freezing means that we are trying to freeze those eggs using liquid nitrogen. So we have with us a chemical called liquid nitrogen, and liquid nitrogen is a chemical which is boiling at minus 196 degrees centigrade, in which we keep our eggs and we can freeze them for lifelong. Now, egg freezing is a technology which came around 15 years back, and now it is being used by nearly everyone in the world, and it has got very good results too. So when we started our journey in egg freezing, we had a lot of difficulty in terms of outcome. कि egg को हमने freeze तो करा, but we were not able to get good outcome. But now things are much better, and egg freezing has got nearly 95-96% of result. So what we freeze, the same thing we
నీ
get.
సెల్లో ఇది పంపుతున్నాను.
So in case, madam, you are back, you can go to Vijay, you can, in case you're back, you can start. So the egg freezing is done for multiple indications. And like to ask me, हम egg freezing कब करते हैं? And so there are multiple indications of egg freezing. And these indications and these indications are nowadays the social reasons. A large number of women they go in for egg freezing because they want to prolong. They want to get married late. They want to get married late, so they can preserve their fertility. So, fertility preservation or social egg freezing is one of the very common reasons where people want to do egg freezing. It is called social egg freezing, where the woman is working, the girl is working, and she wants to wait for some more time before she takes a decision to get married, so her eggs can be frozen. That is called social egg freezing. Egg freezing is also very commonly done for indication where the woman may be having, when we are doing an IVF for her, and when we do the IVF for her, we generate more number of eggs from her, which we want to, which we'll be using, and then we can do her egg freezing. So freezing of the eggs is done primarily for two very common indications on daily basis. That is to prolong her fertility. That is called social egg freezing. और फिर हम जब उनके spare eggs भी बनते हैं during IVF, we do egg freezing. That's number one. Then we also carry out egg freezing in case the woman has got cancer. A young girl who's more than 18, 19, 20 years of age can undergo egg freezing by when she's got a cancer and she may be needing some sort of drugs or therapy for her cancer. We do that. That is called oncological indication. We do it for in case she has got some sort of a disease for which she needs chemotherapy or radiotherapy besides cancer, like autoimmune disorder. We carry out egg freezing, and then it is also done for in case she's got a benign disease like endometriosis, where the ovaries, जब उनकी ovaries में तकलीफ हो रही है, ovaries are getting diseased, we can also carry out egg freezing. So egg freezing has got multiple indications, starting from social egg freezing. It can be for freezing the spare number of oocytes which we recover, for cancer, where we freeze them to when we have to do a surgery for the cancer, we do egg freezing, or when she has to take chemotherapy or radiotherapy or any disease like endometriosis, egg freezing can be done. I think Dr. Vijay is back. So, madam, in case you are back, you can hear me. You can start the conversation. Dr. Vijay is not able to hear to us. I think she's unable to hear to us. You are muted, madam. You are muted. So these are a few indications of egg freezing. So I'll, I think continue the conversation with you. What do we do when we have to carry out egg freezing? So the woman who come to us to prolong her, delay her marriage or wants to get married late, there the egg freezing is being done as a cause known as social egg freezing. So we have to counsel her that egg freezing is a good thing to do, but that should be done at a younger age. So social egg freezing should be done at a younger age in case she delays her pregnancy, and she then probably the outcome may not be all that be good. That's number one. So when we do egg freezing, we should do it at a younger age. That is very, very important. In case she comes to us at around 38 years of age or 39, then the outcome may not be good. So first important thing which we have to know is that we should do egg freezing at a young age as compared to an elderly age for the woman, because by that time her quality of egg will go bad. That's one thing which we have to keep in our mind. Secondly, egg freezing जब हम करते हैं, इसमें काफ़ी एक्सपेंडिचर होता है. People have to spend a lot of money, and more money is spent for freezing, because once we do any egg freezing, her oocytes will be kept for 7, 8, or 9 years, and for every year she'll pay around rupees 30, 40,000 rupees for yearly freezing, which is quite a lot of money. So we have to take care that we counsel them about the expenditure on that. Number three, जब हम when we carry out egg freezing for anyone, we carry out egg freezing for anyone for cancer or any other disease, then we have to do their proper counseling so that they know what they're getting into. Dr. Vijay, are you back? Are you able to
Yeah,
hear me?
sir, yeah, I'm able to.
Great. Over back to you. Back to you. So I have
Yeah, like
done.
as it's my laptop is not good, so I logged in my mobile.
No problem. यही तो मजा
Uh,
है सीखने का. यही तो लाइफ
I
का.
haven't I haven't
Right.
introduced about you, sir. I want to introduce about you, sir.
No problem.
If
We'll
it
come to the topic now. So, Dr. Vijaya is from us, and Dr. Vijaya is a great friend of ours, and she's from Telangana, and she's from a place called Godavari Kani, and she's working at Vijaya Fertility Center. A very dear friend, and today she's with us, and we'll talk about egg freezing. Dr. Vijaya, I've spoken to them about what is egg freezing and the indications, and now you can take over from here. Over to you.
so like how will you counsel the patient, sir, and how will you evaluate and counsel the couple when they approach you regarding if the suppose the patient is elderly or patient is suffering from some malignancy or some other like genetic problems, then how to evaluate the patient and how will you counsel the patient?
Yes, very good question, and बहुत अच्छा सवाल है आपका. Very good question you have brought in. We just covered that. How do we evaluate? So first of all, social egg freezing, which we carry out. Social egg freezing हमें सबको ऑफर नहीं करनी चाहिए. Because in case you do social egg freezing, then a large number of women, they opt for the technology, and they delay their pregnancy. I personally feel थोड़ा सा debatable issue है, but I feel that the in case we do it at early age, it is good. At elderly age, more than 35, 36, it is not good, because that time quality of sex is not very good. And besides that, I always like the women to get married at the right time, and have their own natural pregnancy, because in case we do egg freezing, then we'll have to go in for IVF. So we have to counsel the women who come for egg freezing that it entails some expenditure, and even if they have done it, they shouldn't delay their pregnancy more than 37, 38, because in case they delay the pregnancy more, they can have pregnancy related problems. So they should try to conceive as early as possible. I think हमारा जो मेन काम है डॉक्टर विजय, that is about counseling the people about their emotional well-being. So we should be a good educator. We should be a good. We should be doing their hand holding and help them to allay their anxiety. People are very scared, whether it is for social egg freezing or it is due to some cancer or chemotherapy or endometriosis. They are very scared. They don't know what they're getting into. So we have to allay their anxiety. We have to manage their fears and give them confidence that it's a very well time tested procedure, nothing goes wrong. And then we have to help them to take the right decision so that they can do it at the right time. That's very, very important. And there are complex dilemmas. The girls nowadays are worried that they have banked their eggs, or how long they'll be there for how long we can freeze them, how long the eggs will be healthy in the liquid nitrogen. Their parents will like to know that my daughter is banking their fertility. Is it right or wrong? So there is an emotional component to it where we have to guide them. There is a financial component where we need to tell them कितना खर्चा आता है, how much expenditure they'll have to do, and then we have to basically fight their stress and we have to empower the patient so that they know that even if we delay their pregnancy, they are doing good. So I think these things, counseling is very, very important before we go into the procedure.
Suppose a patient is diagnosed with malignancy, is it right to talk regarding egg freezing and all when she is very much scared of her life? And I think it's ethically, what you say, sir?
Yeah, we should, ma'am. We should, because nowadays the cancer cells, they don't go inside an egg. The cancer cells are outside the egg. So I think in case we're able to do their fertility preservation, the eggs are safe. Number one. Number two, very important fact is that they got the right to parenthood. Every young girl has got a right to parenthood, and nowadays cancers are very easily managed by giving them good drugs. So their 5 or 10 year survival rate has become quite more. Their 5 or 10 year survival rate has become much more, and they live longer. And when they want to live longer, they want to attain parenthood. Dr. Vijay, I think what I am finding is that cancer incidence in young population is increasing. A lot of young girls are having malignancy like Hodgkin's or leukemia or maybe breast cancer or some cancer in any other part of the body.
And
Cancers
BRCA1 and
are becoming common.
BRCA2.
Yeah, so we can treat
BRCA1
them
and
better.
BRCA2.
Yes. So we can treat them better. I think we should give them the benefit of doubt. So whenever they come to us, we should freeze their eggs and then give them their chemotherapy or radiation therapy. This is very important for us. And then after the chemotherapy is over or radiotherapy is over, they can be given a chance to when they get married. When they get married, she's a cancer survivor now. When she wants to get married, she can take her eggs and become mother again. So this is a very, very noble thing. From my heart, I feel that every girl deserves the chance of having parenthood, and we should be helping her.
Okay. So, who are all eligible to do these procedures like egg freezing and all? What are all the legal aspects involved in this?
So the legal aspects are that for any fertility purposes in our country, जब भी हम egg freezing करते हैं कैंसर के लिए और for any other reason, it is a part of IVF. और IVF करने का the age of IVF in our country is 21 years. We don't do any IVF before 21 years. After 21 years, any girl can undergo egg freezing, which is called social egg freezing. So
Okay.
which actually I don't like because I feel that the girl should get married at the right age and attain parenthood. But a large number of women nowadays, they come to us at 37, 38, and they are building up their careers and they want to have egg freezing. Yes, they can be counseled, but egg freezing should be done at an early age, not a later age. This is very important for us. We shouldn't delay their pregnancy. For the cancer, when they come to us, when they've got a cancer or they've got endometriosis or they got a disease uh, which warrants the removal of the eggs, they are again eligible. So eligibility criteria are very, very open. Legal aspects are that in case the girl's age is less than 21 years and she needs IVF or any procedure, we have to take permission from Government of India. हम उन्हें चिट्ठी लिख सकते हैं, हम उनसे परमिशन मांग सकते हैं, and after that only we should move ahead. We shouldn't do any fertility preservation for any woman without, and in case her age is less than 21 years, we shouldn't be doing it. We need permission from Government of India because the cutoff age of any procedure is 21 years. Number one. Number two, we have been told as per the law when we read that we can freeze their eggs for 10 years maximum. But such girls, they get married late. They get married late, and when they get married, 10-year embargo is out of them. So I think so. We have to again inform the government of India, our National Surrogacy Board, and only then we'll be able to allow them to freeze for more than 10 years. There are two things. One is a marriage. So marriage should be, in case they're not married, or they are married to, we have two options. In case they're not married, then we have to take the permission of our local guardians or parents. And their age can be any, but we need to take Government of India's permission. And in case they are married, then the age should be more than 21 years. But in case cancer comes at an early age, we need to write to Government of India and take their permission to do their. But we cannot carry out social egg freezing before 21 years of age. This is important for us. We shouldn't do it in a girl 18 years of age. And number two, मैंने आपको बताया that we can't preserve their oocytes for more than 10 years. और अगर हमको उसको delay करना है, so we need permission from the government again to keep them for more than 10 years.
Suppose the patient is younger than 21 years, and if she is suffering from malignancy, then what are the other options? Like, can we freeze the ovarian tissue in such patients?
Yeah. So in case somebody has got a girl is young, some girl is young and she wants to, and she gets cancer, which is pretty common nowadays because childhood cancers. तो यहाँ पर we cannot stimulate them and carry out their egg freezing. तो ऐसे केस के अंदर since we cannot stimulate them, we need to work on them and we can do their ovarian tissue freezing. So जब egg freezing नहीं कर सकते हैं in a young girl, because for her stimulation with hormones, she should have an age of around 17 to 18 years of age. But in case her age is young, then we can carry out ovarian tissue freezing. So this is called OTC. And this is also no longer experimental. Anybody can do it. That is not a problem. It can be done by anyone.
See, sir, my practice is in some peripheral area. So whatever patient come to me is very, very poor. So they are very much concerned about financial matters. So what are the costs involved with this egg freezing method?
So egg freezing, madam, the cost of egg freezing is the cost of the drugs, which is around rupees 60,000 rupees for the drugs, hormones, which you give it to her. And then I think workup करने में around 10,000 rupees, that makes it around 70 to 75,000 rupees. And the cost of the IVF, which will be around 1 lakh rupees again. So I think it will be around 2 lakh rupees. It will come to around 2 lakh rupees, which she'll have to spend. Somewhere around 1.6, 1.7 lakh rupees she'll have to spend to carry out egg freezing. Here it becomes a bit more expensive because we have to freeze their eggs. The freezing is involved, and freezing is not done for 1 year. It is done for say 10 years, and every year she will pay rupees 40,000 or 35,000. So she'll spend around 3 to 4 or 5 lakh rupees on freezing only. That is an additional expenditure. But I think the whole of egg freezing protocol can be done in around 1.6, 1.7 lakh rupees very easily, comfortably with freezing for a few months.
Okay. So what are the minimum number of eggs we have to freeze, sir? Like whatever she gets?
Yeah.
Suppose
So
low reserve patients, we have to do multiple stimulations and
yes,
pick up.
we should have around 7 to 8 eggs minimum frozen for any girl, maybe for cancer or for anything else, because 7 eggs are normally needed to make one healthy baby. So 7 eggs are required. So in case the number of eggs are less, we can do multiple stimulations for self-preservation, which is we are calling social egg freezing, or for anybody else, or for cancer. I think we should have 7 to 8 eggs, and this is important. We should be having it. That's important.
Okay, sir. Like and also they will ask कितना time लगेगा ये procedure करने में. Like if they are suffering from cancer, they will be very much anxiety about the progress of the cancer and all. So कितना time लगेगा? Just brief about that random start stimulation also, sir. So that
हाँ,
they will.
हमारे पास समय आपका हिंदी बहुत अच्छा है. आपका हिंदी बहुत अच्छा है.
Like I studied in PGI, sir, so I know Hindi also.
You are from PGI Chandigarh.
Yes.
हाँ, तभी आपका हिंदी बहुत अच्छा है. आपको पंजाबी भी आता होगा, I'm sure, थोड़ा बहुत.
हाँ, पंजाबी थोड़ा थल्ले आ जाओ.
इधर आ जाओ, अच्छा आ जाओ. पंजाबी में आंदा तन्नू. Great. So, you just know that आपका सवाल क्या था? मैं पंजाबी में सवाल ही भूल गया आपको. What was the question, madam? I just forgot your question while talking.
Like they'll be very much anxious about their disease first. Suppose a
Yeah.
patient is suffering from cancer, कितने टाइम लगता है और व्हाट आर द साइड इफेक्ट्स, और डिसीज प्रोग्रेस हो जाता है इस टाइम में, ऐसे बोल के पूछते हैं पेशेंट्स.
जी, तो हमारे पास समय इसमें कम रहता है. It depends upon the disease. Like a disease like Hodgkin's can wait. Leukemias, some leukemias are hematogenous that they may not wait. So only thing is that we have to know that what type of cancer we are dealing with and what type of drugs we are giving it to her. अगर हम दवाई में उनको हम कीमोथेरेपी दे रहे हैं वो माइल्ड है, शी मे वेट, शी मे नॉट इवन नीड एग फ्रीजिंग. बट अगर हमारी दवाइयाँ के अंदर वी आर गिविंग देम अल्कलाइटिंग एजेंट्स, साइक्लोफॉस्फेमाइड, बुसल्फान, then we should immediately go and do our egg freezing. Whenever we diagnose, I think very important is that all of us should talk to her, counsel her, and counsel ka kaam, the counseling role is very important here because when we talk to her, we need to actually talk to the whole family. It's not only her. We talk to the whole family, talk to her parents, we talk to her relatives, and we tell her about that is decision making. कि आपके साथ में क्या हो सकता है, और ये सब वी विल टेल देम एवरीथिंग. नो, इट्स नॉट कि हमने एक फ्रीजिंग किया एंड देन शी हैज ए प्रॉब्लम आफ्टर 3 years. अगर कैंसर बड़ा एग्रेसिव है देन वी हैव टू से इट मे नॉट हेल्प यू एट ऑल बट वी कैन डू इट. सो वी विल टेल देम अबाउट द प्रोग्नोसिस कि आपका लाइफ कितना कितना प्रोग्नोसिस है, कितना आप जिएंगी. बट अगर डिजीज बहुत ही एग्रेसिव होता है तो हमें इसके लिए मना भी करना चाहिए. देन इट इज नॉट द गुड थिंग टू डू ऑल्सो. वी शुडंट इंडेंजर, हमें उनकी लाइफ को इंडेंजर नहीं करना है. वी शुडंट इंडेंजर देयर लाइव्स. सो आई थिंक इट्स वेरी इंपॉर्टेंट दैट वी एजुकेट देम, द पेरेंट्स. दीज गर्ल्स आर नॉर्मली अनमैरिड. दीज गर्ल्स आर, उनकी शादी नहीं होती है, अनमैरिड. So they are with their parents, and then in case they're married, husband newly married, husbands don't know what is happening. So I think it's very, very important for us to talk to them and tell them that it may be a long drawn process and give them proper shared decision making. So we should all do video counseling. We should have use decision aids, let them read and come back. But I think every girl deserves to get her eggs banked in case she's got a cancer or any other reason, and we should do it as early as possible without delaying it. प्रोटोकॉल्स होते हैं हमारे पास में, टीके होते हैं जब हम कभी भी केस स्टार्ट कर सकते हैं. So I think within, in case anyone comes to us within 10-15 days, we can start their case. It will take around 20 days to finish off their case. हमको वेट नहीं करना है, डिले नहीं करना है. We can do random protocol, or we can also carry out stimulations as early as possible so that we are able to get some eggs from her. And in case we don't get good number of eggs, we should then do it immediately the next cycle and do it again. So AMH करना जरूरी होता है. We should do an ultrasound for them, AMH for them, look at whether what type of cancer we are dealing with, and then take that decision.
So it's a teamwork, like it should involve oncologist, everybody.
Yeah, oncologist. I think we should have an oncologist. We should have an embryologist. We should have
Yeah.
an hematologist, gynecologist, our parents. We should have a tumor board. हम इसे हम tumor board, we call it a tumor board where everyone comes together and talks about the illness, and after all of us we feel that it is fine. And parents, अगर वो बेटी, the girl is young, then the parents will have to sign the informed consent. So that is called an assent they have to give. And in case the girl is mature, balig hai, and she is married, then I think issue is very different. Then it becomes very easy for us. But I think we have to talk to the whole family and make them understand.
Ethical committee is also involved, sir, in this aspect.
Ethical committee is not required for cancer fertility preservation. Ethical committee is not required for social egg freezing. Ethical committee will come into place when we are doing a case in a girl who's less than 21 years of age. The age of marriage is 18 in our country, but government says we give them treatment at 21 years. So when we are treating them less than 21 years, here ethical committee will come into play. We have to take the permission of the ART and surrogacy board. That's number one. And in case we have to freeze them for more than 10 years, we have to take again ethical committee clearance. So there are two places we need ethical committee clearance. And for other things, ovarian tissue freezing is no longer an procedure which is guarded. Anybody can do it. It is no longer an experimental procedure. So ovarian tissue freezing and egg freezing is not experimental. It doesn't need any ethical committee clearance. But I think whenever we're dealing with a case of ovarian cancer, we are dealing with a case of a cancer in a young girl, we should involve the tumor board and everyone should come on board together and talk about the patient and then only we should do it.
Okay. Like once you frozen the eggs, and what is the viability after thawing? What is the rate of like what you say, sir? Like how many viable eggs you'll
Nearly 100%, madam. Nearly 100% because
with
हम जैसे
improved
egg को
yeah.
the way we freeze the eggs, what goes in will come out, ma'am. What we freeze will come out. So in case we do it properly, it will be all fine. And normally, when we do any freezing, we are doing using thing called vitrification. With vitrification, results have become very good now. Initially, we were doing slow freezing. Now we do vitrification. So vitrification gives you very good outcome. So nearly 100%. It's nearly 100%. Done in the good hands is a very good technique.
Okay. So success rates of like take home babies, everything is same like normal, freshly
Normal egg.
pick up. Yeah.
G. Normal egg. But to be done by the right people. जिनके पास experience है, in case somebody has done around 200 egg freezings, they'll be as good. But learning curve is different. It's a bit difficult procedure, but in case somebody is learned, then I think anybody can do it and get you very good outcome.
So like what will you do with the frozen eggs if the patient doesn't want to keep it for herself? Our patient is died with cancer. So
Yeah,
like any other legal,
yes,
you have to
ma'am. So
surrender it to
yes,
government
ma'am.
of
So
India, sir.
government, no, when we have done the freezing, we have taken the permission of the single girl with the parental consent also, guardian consent. And if she's married, we have taken the consent of her side of the husband. Now the consent form is very clear in case somebody happens to the girl, whether husband can use it for somebody else's or not. So उसके लिए consent form in case it's signed, somebody can use it. But in case the girl has not consented, then we cannot use it for anybody else. This is very, very clear. And I think laws are very clear about this. In case we are keeping the eggs, they have to pay money. They have to reply to your queries. They have to keep meeting you. And in case they are out of touch from you and not responding for a long time, in case you look at the embryo freezing form or oocyte freezing form, rules are very clear. In that case, we can discard the embryos. But for that, we'll have to take the permission of Government of India and we can discard them. But we have to inform Government of India. That's very important. अपने आप से नहीं कर सकते. They can be discarded, they can be used for research, but we cannot use it for third party. हमने किसी को we cannot give it to somebody else for use, but we can use it for either we can destroy them in the presence of trusted doctors, or we can use them for research, for embryonic stem cell research, or any research based on oocyte that can be done. But again, after taking Government of India permission, they will take the eggs from you and give it to some unit which is carrying out research. They can work on the eggs.
Okay. So what are the pros and cons of egg freezing?
Pros are more. Pros are more because the girls nowadays can control their life. I think the girls have got the right to work, empower themselves, So large number of women, they want to get married late. Absolutely good. I think we should encourage the women what they want to do. Though I personally feel that the girls should get married by around at 30 and complete their families. But a lot of girls now they're traveling all over the world, and even our children they all want to do well. So in that case, there's an option available. We can carry out egg freezing from them. So pros are that the outcome is very good in egg freezing for spare eggs or for social egg freezing. Even for cancer patients, it's a very, very good option. Outcome is very good, and I think anybody can do it nowadays because it's become very simple. So pros are more, ma'am. A lot of pros are there, and the pros are fantastic. Now coming to the cons, cons is that a large number of women, when they do it for social egg freezing at an late age, then the number of eggs may not be large in number, or they may be of poor quality. So egg freezing done at 30 and 40 is different. 40 साल में egg freezing करके egg quality will come down, egg number will come down. But when you carry out egg freezing at 30, it can be a good option for all the women. So this is again the cons. We should do it early. And for cancer, a large number of times जब हम egg freezing करते हैं, the women won't come back to utilize it because they may not be in the best of health, the best of mind. Sometimes they don't get a partner, so what to do? So they don't come back to us. So they are spending money every month for embryo up for oocyte upkeep. So cons is that in case we don't do proper counseling, they have this problem. So I think we have to counsel them that they have to use them early. Freezing an egg doesn't mean that it can be indefinite. Yes, eggs can be there indefinite. But in case we don't do get in pregnancy early, our body will start aging now. So eggs are not aging, which is our body is aging. Our body becomes old, and that's the time when we get married or our cancer gets over, and that's the time when we start to get that embryos or oocytes being utilized. But then our body will come back with diabetes, will come back with hypertension, will come back with
Hypertension.
multiple diseases, preterm labor. So uteruses become old. Uterus is aging. The husband's sperms are also aging at 40 years of age. These are the cons. और यही this thing आपका जो question was that how do we counsel them? This is the way we counsel them. So we have to tell them beforehand how does it work so that they are in picture of everything. So I think this is very very important. Pros and cons. Pros are more, cons are less in case we counsel them properly.
And also, they'll be under false impression they'll become pregnant for sure if they frozen their eggs.
Yeah. So
But
they have to know
they
that.
don't consider about the quality of the eggs if they frozen
Excellent.
it. Huh.
Excellent. Excellent. So they have to know that it is not all that easy. It's not all that easy. In case they don't take care, the egg quality, in case they come late for egg freezing, egg quality may be poor as such. In case they delay their pregnancy for a long time, their uterus will become aged. So the outcome may be bad. And then they have to always come to us at younger age for egg freezing, not at 38, 39, 40. So whenever we do a scan for the girls, when their ovaries are weak, ovaries are small, AFC is less, ovarian volume is less, AMH is low, FSH is high, such women doesn't warrant to undergo egg freezing because they'll give you less number of eggs and that will be of poor quality also.
So these are the contraindications for egg freezing.
Yes, ma'am.
Okay. And what are the long-term consequences, like on the baby with
Nothing.
frozen egg?
Not so the eggs can be frozen by vitrification or slow freezing. So there are some paper claim that they can lead to some sort of some disorders in the eggs, but overall, all the studies have said that they are safe. So I think egg freezing doesn't give you any problem. The problem will occur in case we use the wrong technique. अगर हमारा technique अच्छा नहीं है, then eggs won't recover. In case a woman comes at an age of 39, 40, and she will freeze her eggs and then expect that eggs will be good, तो वो गलत होगा, because at 38, 39, after 35, egg quality is poor, egg number is less. So I think important ये है हमें जानना. What is important is that they have to know that in case they come early for egg freezing, self egg freezing, social egg freezing, or due to cancer freezing, in case their age is young, then they can have better outcome. और अगर वो डिले करेंगे तो egg quality and egg number will always come down quite a lot, and then they'll have problems. So they are the such eggs, they don't recover well. The eggs have become old, they're less in number, they don't recover well. But in case the eggs are young and freezing is done at the right time, we got very good recovery rate in such patients. So
Okay.
vitrification per se won't cause any problem. So, but the type of egg which we freeze can lead to problems. That depends upon the age and the time we have frozen them, and when they use it also. That's also important.
And also it depends upon the what type of stimulation you have done and how the eggs are retrieved. It all depends on the expertise also of the clinician also, I think.
Yes, very good, ma'am. You are right, Vijay, and you're a thorough clinician yourself. So, in case the clinician is not a good clinician, they will recover less number of eggs. So, we have to have a very good
Hmm.
qualified clinician to do this work. Agreed, ma'am. Absolutely correct.
Okay, sir. Thank you so much. You
So
finished, sir?
lovely.
Like, are there any other questions to? You have given very, very beautiful insights regarding egg freezing. It helps so many people, and it clears all the doubts of all the patients who have logged into this live session.
Yes.
And once again, I thank ICAT Academy for giving me this opportunity. And I just want to give two compliments to you, sir. You are a great walking encyclopedia. Hello.
Encyclopedia.
Yes,
59, I think
because
we all become
whatever
encyclopedias.
questions are asked, just instantaneously you will give the answer. That is really amazing. When I came to the training center, also I was really. And one more thing, and you are Amitabh Bachchan of fertility field.
Oh my God.
because because when you are in the army, you worked under with limited sources, and have you have given some light in so many infertility couples. So hats off to you, sir. Thank you
Thank
so
you.
much.
One question is there. One question for you is there. You can take this question,
Okay,
madam.
okay,
You,
sir.
Alankarita Shrivastava. You can read that question. Can you see that question?
Here I am not able to see, sir, because I am using my mobile.
Yeah. So there's a question that, सर मेरी अभी डिलीवरी हुई है और मेरा एक बेबी बॉय है. Congratulations, Alankrita. We are so happy for you and God bless you. मेरा वेट थोड़ा इंक्रीज हो गया. आई थिंक प्रेगनेंसी में थोड़ा वेट बढ़ ही जाता है. सो प्रेगनेंसी कैन इंक्रीज वेट. Am I right, Dr. Vijay? Pregnancy will lead to
Yeah, yes,
some.
yes. But they can reduce their weight by doing physical exercises and
Yeah,
all
this is
after
you have to
receiving
answer
birth.
now. As a woman, do you know better? मैं प्रेगनेंसी से शी वाज स्विमिंग करती थी एंड स्टेट लेवल चैंपियन जीती थी. सो कांग्रेट्स अगेन अलंकृता, यू गॉट अ लिटिल बेबी बॉय एंड यू हैव वन सो मेनी कॉम्पिटिशंस. आई विश आई कुड स्विम सो वेल. अब बिकनी फिगर कितने महीने में रिगेन हो जाएगा सर? मैंने आप पहले जैसा बिकनी फिगर चाहिए. ओवर टू यू
It's
विजय.
it's very easier for her because she is an athlete. It will be very easy
Athletes.
for her because she knows how to maintain her figure and she know what are all the exercises she has to do. So I think it's very easy for her, I think.
है ना? So I think Alakrita can go back to a swimming pool and start swimming.
Ah,
So this
yes,
will
swimming is a very good mode of fitness.
and little boy will keep you awake all the time for a few months, but then you can go to the pool and swim and you'll be fine, Alakrita. So I don't take any medication, but दवाई मत खाइएगा. Don't take any medications. Don't take any drugs. You'll be fine. It's a normal thing. So thank you so much, Dr. Vijay, and thank you so much everyone who have joined.
Thank
It's
you
been a
so much.
great. Thank you. It's a
Excuse me
great.
for the hitch in the beginning, sir, because that laptop I don't know it was working very well before, and suddenly at the time of this thing.
No. This is important, ma'am. So we call it an alumni grooming program. This is what happens when you do the
Huh.
life. Things go wrong. So fighting it out, and your team helping you. You saw your team was running around. The girl who is with you is running around everywhere with your
I
phone.
know, like she is my right
Is
hand.
she around? Can I say hello to her? Can we say hello to her, madam? Can we say hello to her? Hello, namaste.
She,
Thank you so much. You did well, and this is wow. The right hand should be. So my right hand is Garima sitting with me. So these are the right
she is
hands.
Victoria. She's all
Victoria,
in one.
okay.
Huh.
All in one. Your
Yeah.
face. She's my Victoria. Sitting with me. So these Victorias are very. So thank you, Victoria and Garima. Thank you so much. I think we have to fight few battles, and so a big thanks to my whole team, Mohit, Garima, and me and you, Vijay. We'll meet again in some time and carry on.
Sure, sir.
And
You have to involve me in some academics. I'm
yes,
very
madam,
much eager
we
to
would, we
part.
would. We good, madam. Great. So, guys, we're gonna come back again in some days with some new topics. You're aware of the topics, and we'll continue our discussions. Till that time, in case you have any doubts, any problems, we are there with you 24/7. You have our numbers on the screen, and you want to know anything, just call us up, give us a call, or you can visit us on Instagram, Twitter, LinkedIn, Facebook. We are there everywhere. YouTube, we are there too. So thank you so much. Jai Hind. Take care, and Vijay, take care. I
Thank you,
hope
sir.
Telangana.
Thank you so much.
Thank you.
Thank you so
Jai Hind.
much.
Thank you. Thank you.